Welcome to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti. My guest this evening is Dr. David Banach from UConn Health. Dr. Banach, welcome. How are you?
I'm doing well. Thanks for having me on again.
Hey, thanks for coming down. So, what's new?
Well, from an infectious disease perspective, I guess I'm trying to think how long it's been since we've spoken, but certainly a lot going on with COVID and more recently monkeypox, and in addition to all the usual challenges that we deal with at this time of year.
Absolutely. Now, as far as COVID goes, how are things going since the last time you and I actually had a chance to chat?
So, I think, over the summer months, we've seen some fluctuation. Early in the summer, we saw in Connecticut, at least, a little bit more virus circulating. We've got these BA4, BA5 subvariants that seem to have taken hold. And then over the last few weeks, I think things have somewhat plateaued. Still seeing, COVID occurring in the community and some patients in the hospital as well. But the numbers overall seem to be stable as we move into the fall seasons.
Now, tell us a little bit about yourself and what exactly you do for UConn Health.
Sure. So I'm a physician by training. So I see patients. My training is specifically in infectious diseases. So I see patients with various infections in the office, as well sicker patients in the hospital as well. And additionally, my role is in infection control and epidemiology. So I have some public health training and get involved with infectious disease issues in the hospital and the community. And am involved with our infection control program here at UConn Health, in addition to some teaching that I do in the medical school and some research as well. So kind of a mix of different things.
Now, what do you teach?
I teach a few different courses. I teach microbiology to the medical students. I do some coursework in the clinical training, as students start to acclimate to the hospital, to clinics, sort of teaching clinical skills and sort of the foundations of clinical medicine. And then a little bit further on, the students that are in residency, we train them on infectious diseases and treatments. So kind of a mix of different things depending on the students.
Absolutely. Now, as far as the virus goes, from the last time we talked to where we are now, things are going. How are things looking?
Well, I think in some ways we've plateaued over the last few weeks in terms of the amount of COVID that's been circulating in the community. So we're still seeing a substantial number of COVID infections in Connecticut. I think fortunately fewer proportion being hospitalized as we had seen in other phases of the pandemic. Mm-hmm. I think a lot of that is attributed to immunity now that's developed in the community. So most people now have had either a full vaccine series and a booster, multiple boosters, and even some infections in addition to boosters. So that all confers some degree of protection. So I think we're seeing some immunity in the population that is having an impact on reducing hospitalizations, but nonetheless, we're still seeing individuals hospitalized with COVID here at UConn and across the state. So it's still out there, and I think the public needs to be mindful of that moving into the fall.
Now, start to finish, how long does it take? Do you think the COVID is ever going to be over, or is it going to be here, or is it here for a while?
Yeah, I think it depends on how you look at it. So I think this virus is now going to be moving into an endemic, what we call endemic phase. So it's going to be circulating, similar to what we see with other viruses like the flu, other viruses that cause colds. COVID is going to be one of those viruses that's going to be with us. I think in terms of the earlier phases where we saw surges of cases and hospitals that were pushed to capacity and really high mortalities. I think we're not in that phase at this point, which is encouraging. Something we have to be mindful of. The virus has shown that it can do different things and change in some ways, and that could change the picture. But I think at this point, it seems to be more moving into an endemic territory where it's going to be with us. We have to sort of learn both as a community and as a healthcare world on how to help, manage the impact and certainly take care of patients when they do have infections and do what we can to try to prevent those infections from occurring.
Now, as far as, and I know there's probably a couple different booster shots out there. What's the difference between all the booster shots out there?
Yeah, so as of a couple of weeks ago, the FDA approved what we call the bivalent boosters. Okay. So The original boosters that have been offered up until now were monovalent, so they only had the one strain, which is the original strain, what we call the ancestral strain, the strain that first appeared, in Wuhan, China. That's what the original vaccines were all based on. But these updated boosters are bivalent, so they have that strain, but they also have a strain of the Omicron variant, which is the most recent variant that's been circulating now over the past year. So the hope is that by combining that, you'll be able to generate into a vaccine, you'll be able to generate a more specific immunity towards those variants that have been circulating this year. And that'll provide additional protection beyond what was provided with the monovalent vaccine that was really directed at the initial virus strain.
Now, what's the difference between the different variances?
So the variants differ in a few ways. So some of the newer variants seem to be a little bit more contagious, or in some ways significantly more contagious. So they spread a little bit quicker in the population. The virus kind of adapted to be able to do that, to basically allow it to spread in the community and be transmitted more easily. And then in some ways, these newer variants have changed so that they can evade some of the pre-existing immunity. So, individuals who may have had COVID infection very early on in the pandemic, like in 2000, infected with one of the early variants, now may not have that level of protection against these newer variants because the virus has changed to be able to kind of evade that immune system protection. So those are the two major changes that we've seen in variants so far. The newer variants don't seem to be cause more severe illness per se, but that is something we have to keep an eye on. If we start to see a new variant that is causing more severe infection, then we'd have to recognize that and respond to it.
Now, obviously, it's very important to go get your booster shots when your age eligibility comes up, correct?
Yeah, so we've seen that over the last year, the booster shots have been very effective in preventing severe infections and hospitalization. They seem to be most effective in higher risk groups, so older individuals with other medical conditions that would predispose them to more severe infection. And that's expected to hold true with boosters moving forward. The general recommendation from CDC is that everyone who's 2 months out from their last COVID vaccine is able to and recommended to get a booster. That's kind of where we are now. But certainly most important would be those individuals who are at higher risk, like the elderly individuals or people that have those other medical conditions. So, the current recommendation, though, is for everyone who's 2 months out from initial vaccine or from their last booster to go ahead and get another booster.
Absolutely. And obviously, you think they're going to continue with boosters, or?
Hard to know for sure, but from what we've seen with the protection from boosters, it does seem to bump up. And over time, unfortunately, that does seem to wane. So, as long as we're seeing COVID circulating in the community, I do expect that in the future there'll be additional boosters. The frequency, a lot of people are asking, is this going to be like a once a year vaccine, kind of like the flu? It may very well be, but I think it's a little too early to predict. Both the time period between boosters and also if the boosters are going to need to be further adapted. Based on changes in the virus.
Now, as far as once you get the booster shot, can you still catch the virus?
You can. So the boosters are not, 100% guarantee that you won't get COVID. But what they do is they reduce the overall impact. So even individuals who do get COVID after getting a booster, the degree of symptoms is milder. They're protected against hospitalization and really severe infection. So that benefit is there, even for people who, do develop an infection even after getting a booster.
Now, as far as the symptoms go, what are some of the symptoms if you think you have COVID?
Yeah, I think, the symptoms that we've seen with the most recent variants, seem to be mostly upper respiratory infections. So, okay. Seeing a lot of nasal congestion, cough, sore throat seems to be quite common with the more recent variants, fevers as well. And all of that, can be associated with the fatigue and kind of generalized weakness, lasting for a few days. Fortunately, we're seeing fewer people that are progressing to pneumonia, and those are the people that usually require hospitalization. So we're seeing fewer of those individuals for the reasons that I mentioned earlier.
Right.
But nonetheless, I think we're still seeing a full spectrum of symptoms that develop. But it seems like upper respiratory symptoms, particularly the nasal, sore throat, and cough symptoms, seem to be predominant right now.
Now, as far as quarantining, they're still telling you if you think you have it, or if you have it, how long should you quarantine for?
So, if you do think that you have COVID, the next step is to get tested, and certainly to quarantine, at least until you, or isolate, it would be the term, until you get that test result. And if you do test positive, the recommended isolation period is still 5 days, and then you can go back out in public wearing a mask if you're going to be around others for another 5 days. So 10 days total of added precautions, which includes the 5 days of isolation, followed by the 5 days of masking.
Okay. And as far as what are some other things we want to tell people about COVID and prevention?
Yeah, so treatments are important. If for individuals that do get COVID, vaccinated or not vaccinated, there is that benefit from treatment.
Okay.
The main treatment that we're using now is the oral medication Paxlovid, which I think I may have discussed last time we spoke. So that's a 5-day course of an oral antiviral medicine. That's really what almost all individuals who have COVID, who are at high risk, receive. The other alternative is the monoclonal antibodies. Those are still available, and they're really now being used only in individuals who can't take Paxlovid because of a contraindication or an interaction with a medication. Those are the individuals who are eligible for the monoclonal antibody infusions. But that's really becoming a small number of people. Really, most are receiving Paxlovid as the treatment of choice. So, for individuals out there, if you do test positive and you have any medical conditions or older age, reach out to your clinician and see if you can get Paxlovid, because that medication, the earlier you start it, the better in terms of the overall impact and improving the outcome.
Now, what exactly is Paxlovid? Can you explain
So
that?
it's a pill. Yeah, it's an oral pill
Gotcha.
that can basically block the virus from replicating. So it sort of prevents the progression of more severe infection. That's what we see when the virus replicates at higher and higher levels. So that's the goal of it. It's 5-day course of treatment. It's one dose twice a day for the 5-day period, and people seem to be tolerating it quite well.
Dr. Banach, would you mind sticking around for another segment?
Sure.
All right, we'll be right back.
Better Business Bureau Scam Tracker is getting reports of party hosts tricked by rentals that don't materialize. Avoid party rental scams by doing your research first at bbb.org. Also, search the business's name plus the word scam. You may need to fill out a contract with personal information, but make sure you are dealing with a legitimate company before you hand over sensitive information. Be wary of people who contact you on messaging apps. Make sure they have a website and working contact information. Always pay with a credit card. It's much easier to dispute fraudulent charges.
You matter.
You matter.
You matter. And your words matter too.
Your words matter.
What you say in the hallways at school or in the student section at a game matters.
Words can be hurtful.
Words can be offensive.
Words can leave scars.
Words can also inspire.
Support
and uplift.
You and your words.
Are they both important?
As a matter of fact, yes.
Welcome back to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti, joined by Dr. David Banach from UConn Health. Dr. Banach, welcome back.
Thank you.
Thank you. So, Dr. Banach, let's open up this segment talking about, and you maybe can explain this to me, what is monkeypox?
Sure. So, monkeypox is an infection that's caused by a virus. So,
Okay.
It's called the monkeypox virus, essentially. So, it's a virus that's similar to some other viruses. So it's similar to smallpox. Also, in some ways, it has some similar characteristics to other viruses like that cause chickenpox. So essentially, it's a virus that can be passed from person to person, can also be passed from animal to person, and it can cause a wide spectrum of infection. So the most common infection that we see are a severe rash, usually raised bumps on the skin, kind of like pimples, and they can be quite painful. In some situations, they can progress to become quite severe throughout a large portion of the body, and in severe cases, they can even lead to breathing difficulty, respiratory symptoms, and more severe infections. Sometimes the rash can be associated with fevers and swollen glands in the body too, and can be quite variable. So this virus is something that has been identified now for decades, but was really geographically very limited. Initially, almost all of the cases were in Africa, so quite rare to see it outside of Africa. And pretty much whenever it was seen outside of Africa, it was seen in someone who was recently traveled to Africa. And more recently, with the current outbreak, and we can talk about it in some more detail, we're seeing cases across the globe, many cases, it seems to have spread into communities that wouldn't necessarily be exposed to monkeypox based on the previous spread in epidemiology. So a little bit different now. It's having a significant impact on some portions of the population.
Now, is there a vaccine for monkeypox?
There is. So there's a vaccine. It's called Janios is the name of the vaccine.
Okay.
And it was actually interesting. It was actually a vaccine that was initially developed to prevent smallpox, but was found to also prevent monkeypox. And was reviewed by FDA for both indications to prevent smallpox and prevent monkeypox. The original development was spurred by, you may recall, concerns about smallpox being developed as a bioterrorism a couple of decades ago. So that was the original intent of the vaccine, but being active against monkeypox was important. So we do give that to individuals in a few different types of situations if they're at high risk for acquiring monkeypox infection.
Now, as far as being high risk for monkeypox, how can you tell if you're at high risk or not?
So the highest risk situation would be coming into close contact with someone who's had monkeypox. So, for instance, having close skin-to-skin contact and then finding out that person just tested positive for monkeypox, or someone who potentially who you live with and are in very close quarters with, that would be a higher risk exposure. So if you have that level of exposure, then the vaccine is given to prevent development of infection and symptoms. There's other sort of population-based factors that we're seeing. So a large proportion of individuals in the current epidemic of monkeypox that have had infection are in the men who have sex with men community. So gay males, particularly in that group who have had multiple sexual partners, there seems to be an association with transmission of monkeypox. So right now, a lot of the vaccine efforts are really targeting that specific population as being highest risk for infection and prioritizing that group for receiving the vaccine. But we'll have to see if there's signs that monkeypox is starting to spread significantly in other groups. Those groups will be the focus for the vaccine as well moving forward. So it's still evolving, and I think important to sort of be mindful and keep an ear to what's happening with it.
Absolutely. Now let's talk about the flu and flu vaccines.
Sure. So we're moving into what we typically see as flu season, right? So flu season usually in the Northeast is in the winter. We think December, January, February, typically the months that we see flu here in Connecticut. Interestingly, probably for a few reasons, the flu seasons have not been typical the last couple of years. And that probably relates to everything that's been going on with COVID, including some of the measures that have been taken to prevent COVID. So we've seen milder flu seasons in the last couple of years. And later flu season. So we've seen more flu cases in like the March, April territory, which is on the later side. It's a little difficult to predict what we're going to expect with this year's flu season. But the goal is that everyone get their vaccine before we get into flu season, because that's going to help provide that protection against developing any severe flu infections. So I think that's why we're going into September, October. This is really the time that is recommended to get that flu vaccine to protect you in the subsequent months when we typically see flu circulating.
Now, is it too early to get your flu shot, or is it timing wise, or is it about this time?
There's some controversy there, and a lot of it stems from the difficulty in predicting when flu is going to peak. We just don't know. We sort of base our recommendations on what has been seen in prior years, which is typically, circulation in the United States in the wintertime. So the recommendation from CDC is that by the end of October that you get your flu vaccine. Whether it's too early, I think it's very hard to time. The thing you don't want to do is be in a position where it's too late. So you get flu, but unfortunately weren't able to get a vaccine before, because even if you get a vaccine early, you still have some protection later on in the flu season. It may not be as high as it would be, shortly after getting vaccinated, but there still is that benefit there. So, I think the message right now is, by the end of October, get that flu vaccine to get you that protection going into this winter.
And obviously, the flu vaccine is readily available, correct?
Yeah, so the flu vaccines are now very readily available. We started giving them out here at UConn about a week ago.
Okay.
And now all the retail pharmacies stock them, and most doctors' offices that give flu vaccines now have them readily available. I think getting a flu vaccine in terms of logistics shouldn't be difficult. They're out there, there's a couple of different flu vaccines which we can talk about that are available. But right now the message is that the flu vaccines are out there. Go ahead and get one to protect yourself.
Now, what are the different flu vaccines out there?
Yeah, so this year there's two different groups of vaccines. So there's the standard dose vaccine, and then there's the high dose or adjuvant vaccine, and that is intended to be given to older individuals. So really targeting individuals above age 65. Those groups are recommended to get a higher dose flu vaccine or an adjuvant vaccine. It basically helps generate a bit of a more robust immune response for the older individuals, because we know that older individuals inherently have less of an immune response than a younger individual to vaccines. So that's why this sort of more potent higher dose vaccine has been successful in producing that higher level of antibody to that group that's at higher risk and more likely to naturally generate less immune response. So if you're over 65, seek out one of those high dose or adjuvant flu vaccines, and talk to your physician or your clinician that helps provide that vaccine to ensure that you get that recommended vaccine.
Absolutely. I actually got my flu vaccine last week.
Oh, great. Yeah, no, this is the right time to do it.
We've got a little bit more time left, so what else would you like to talk about?
Yeah, I think we're trying to think what the winter is going to hold. I think in the Northeast here we typically see these respiratory viruses circulate. Flu, other cold viruses, now COVID, and it's a little difficult to. A lot of people are asking what the prediction is for this winter, and I think it's very difficult right now to predict. There's some signs that could point to this being a more severe flu season than what we've seen in the past. It's probably a combination of sort of a lot of the loosening of all the restrictions and preventive measures that we've had over the last couple of years, like the masking everywhere. That's really not happening right now. So we may expect that to contribute to more flu activity and more circulating viruses in the community than what we've seen in the last couple of years. Also, we look at patterns that have happened in the southern hemisphere to try to predict what we're going to see here in the northern hemisphere. And this past flu season in Australia was more severe than what had been seen. Certainly since the pandemic started, but even in a couple of years prior to that. So, kind of a potential warning sign that we may be in for a rough flu season. So all the more reason to really go ahead and get that vaccine and do what you can to protect yourself. And, a lot of people also forget that some of the infection prevention measures that we've been using for COVID also are very applicable to flu. So if you do develop symptoms, even if you take a COVID test and it's negative, you may very well have the flu. And important to try to stay away from other people. If you're going to be around other people, wearing a mask is a great way to try to protect those around you from becoming infected. So, those kinds of principles, addition to the hand washing and, the other standard infection prevention measures can really pay off if we do see ourselves moving into a more severe flu season. So, just be mindful of what's happening, pay attention to what you're hearing regarding these viruses circulating and, just try to stay on top of things as best you can moving into the winter.
Obviously, hand washing and social distancing and all that other.
Yeah, I mean, I think all of those play into improving your health in general. I think we're learning a lot from COVID on what can be effective. I think having seen that those measures that we incorporated to protect against COVID have also reduced flu and other viruses. I think there's something to learn from that too. That we can apply moving forward. So, we'll see how things unfold in the coming months, but, try to remember sort of the basic infection prevention hygiene measures that we've been sort of trying to reinforce since the pandemic started is really important.
Absolutely. Well, David Banach from UConn Health, we're about to run out of time. So thanks for some time, and hopefully we'll see you again soon.
All right. Well, thanks again for having me on.
You got it. On behalf of David Banach, I'm Pete Mezzetti. Thanks. Good night. We'll see you next week.